Ever pondered the complexities of Medicare and how it functions? Well, today we're going to unravel this mystery and break it down into simple, digestible bits. Firstly, let's understand what exactly Medicare is. Medicare is a federal health insurance program in the United States, primarily for people aged 65 and older. However, it also covers some younger people with disabilities and those with end-stage renal disease, which is a permanent kidney failure requiring dialysis or a transplant. Medicare comes in 4 parts: A, B, C, and D, each covering different aspects of healthcare services. Medicare Part A, often referred to as hospital insurance, covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home healthcare services. Medicare Part B, or medical insurance, covers certain doctor's services, outpatient care, medical supplies, and preventive services. Medicare Part C, also known as Medicare Advantage, is an all-in-one alternative to original Medicare. These bundled plans include Part A, Part B, and usually Part D. Lastly, Medicare Part D, added to Medicare to cover prescription drugs, helps cover the cost of prescription medications for both short-term conditions like antibiotics for pneumonia and long-term drug therapies like drugs to reduce high blood pressure. Now, you might wonder how to qualify for Medicare. Generally, you are eligible for Medicare if you or your spouse worked for at least 10 years in Medicare-covered employment, and you are 65 years or older, and a citizen or permanent resident of the United States. There's also the question of cost. While Part A is usually free if you or your spouse paid Medicare taxes while working, Part B does come with a monthly premium. The cost of Part B can depend on your income, with higher earners paying more. Part C and D costs will depend on the specific plan you choose. To summarize, Medicare is a federal health insurance program primarily for people aged 65 and older, but it also covers some younger people with disabilities and those with end-stage renal disease. It's divided into 4 parts: A, B, C, and D, each covering different aspects of healthcare. Eligibility is typically based on work history and age, and while some parts of Medicare are free, others do come with a cost. Despite its complexities, Medicare is a vital part of healthcare in the United States, providing coverage for millions of people. As with any insurance program, it's important to understand what it covers, how it works, and what it costs. And with this breakdown, you are now one step closer to understanding the ins and outs of Medicare.